Hi everyone, welcome to our AviClear event. I'm Elizabeth. I'm one of the PAs at Newport Beach Dermatology and Plastic Surgery. I'm so excited to welcome you guys to this event so that we can learn about the treatment of AviClear for acne. I would love for you to stay for the whole presentation. We'd love for you to stay present during the whole presentation. After the presentation is given, there will be a live Q&A section where you can enter your questions or comments in a question tab, and we will be answering those questions live, which will be super fun. And then at the end of the presentation as well, we're doing a special actually on the AviClear treatments. That's going to be for everybody who purchases an AviClear package. They'll get that package 10% off, and they'll get an MD acne kit, which is skincare that you can use at home for acne prone skin. And then one special person will be selected to get a free Diamond Glow facial. Okay, so when we're talking AviClear, first of all, what is it and how does it work? AviClear is a laser treatment that is a specific wavelength of light to target the sebaceous gland. That gland is the oil gland, and in patients who have acne, they often have an enlarged gland, and that gland is producing too much oil. So the AviClear is really cool because the specific wavelength of light actually targets that sebaceous gland, heating the gland, and it also protects the rest of your skin. So via contact cooling of the tip of the laser, we're going to protect the other structures of the skin by cooling that part, while also delivering energy into the sebaceous gland specifically to target that oil production. So the cool thing about AviClear is that it is a laser treatment, meaning there's no oral medication or topical medication that you have to take. Oftentimes we will have patients do a combination of treatments, but this is a great solution for someone who maybe doesn't want to take an oral systemic medication and wants to use this energy in the form of a laser to treat the acne at its root cause and to treat the sebaceous gland itself. So who's a good candidate for the AviClear laser? Really anybody who's looking to use a laser to treat their acne, maybe someone who doesn't want to take an oral systemic medication for their acne, or someone who's failed other treatments for their acne, some of the traditional treatments for acne. And really a great part about the AviClear laser is that it's not specific to certain skin types. So a lot of lasers are going to be only safe for very fair skin types, but it's a really great laser because it can treat multiple skin types and including the darker skin types as well. So in the clinical trials performed on AviClear, it was done in a series of 3 treatments. So we'll do one session, 1 month apart from each other, and after the 3 sessions, then you're done with the treatments. In general, though, the results are about 6 to 12 months after the treatments, where you would start to see great improvement in your acne. In general, the downtime is pretty minimal. I have most of my patients seeing some redness, maybe some swelling that can last anywhere from even just a day to 3 days after the laser. Additionally, there is some increased acne that can happen about 2 weeks after each session. So you'll do the session and then you might have some things kind of coming up to the surface about 2 weeks after each session. But in general, the downtime is pretty minimal.
My name is Cora Harmon. I want to tell you guys a little bit about my experience with AviClear. Overall, I would say I'm extremely pleased. Absolutely. I struggled with acne off and on for about 3 years, mostly hormonal, showing up around my cheeks, my chin area, coming in closer to my nose, which has left me with a bit of scarring. But after AviClear, I feel like my confidence is back. I feel like my self-esteem has risen. Just overall, I think it was the best decision that I've made for myself for a long time. A little about my experience. So the lasering, if you've had laser before, you know that it hurts. It's the kind of like bee sting feeling. And unfortunately with AviClear, you can't have anything on your face. It needs to be extremely raw. You can't have any numbing solutions, unfortunately, which at first I was kind of nervous about. But after speaking with the people that were performing I don't want to say procedure, the laser, they were very open with, turning down the knottage if I needed it to, and playing music if I wanted it on. They were very, very accommodating, and that's just a whole nother thing. The staff at this facility is so fabulous. What was it like after? Afterwards, I did have some redness immediately after. They'll fill you in, no makeup on your face, nothing too strong. Be very, very simple with your skincare routine afterwards. For the most part, it was just redness, a little inflammation, but it went down literally by the second day. How long until I saw my results? So as they'll kind of walk you through the process, you don't see results right away. Personally, after the second treatment, I think it was a little placebo because I was already like, oh my gosh, my skin, it looks great. But it takes a little time. Honestly, after that second treatment, though, I felt my confidence rising way back up, being the person that I'm meant to be because of AviClear. I think that the results, they started around second, third treatment and really just continued progressing even after everything was done. And now I feel my skincare routine is so light. I barely have to do anything. Anything I do choose to use is really just, it's my choice to use them. There's nothing that I have prescribed anymore by a doctor, which is fabulous. Less appointments, less checkups. Anything I do see coming out is really just hormonal or a reaction to something I shouldn't have put on my skin. Let's see, is there anything else? Gosh, if I'm forgetting anything, the doctors will absolutely fill you in. Overall, my experience with AviClear was very positive. The staff is wonderful at this facility. Overall, I just think if you're considering it seriously, I would go for it. Absolutely. I would do it again in an instinct. I feel just very, very good with the way that my skin has turned out. I even, I don't know if it's supposed to, but I even think some of my scarring had cleared up. But yeah, anyway, thank you so much for listening to me. Everything went well. Yeah, gosh. Anyway, have a good one. Good luck with your AviClear experience. I hope that it does for you what it did for me, because I'm very, very thankful for everything that came afterwards. So, goodbye.
So if this sounds something that you might be interested in doing, I would love to have you come in for a consultation. Because of this presentation, I would love to chat with anyone who's interested, and I'll put a few blocks on my schedule. That way, if you think you want to do a consultation and you could be a good candidate for this, we can kind of chat about it. Today is the 12th, so you have until the 15th to purchase the series. And if you purchase the series by the 15th, then you qualify to receive the special, which is the 10% off, the MD Acne Clearing Kit, and then one person out of those people will be chosen for a Diamond Glow facial as well. And then again, don't forget to stay on for the live question and answers.
Hello.
Hello. Thanks for joining us tonight. We really appreciate you guys taking the time out to learn about this wonderful treatment called AviClear. I thought, Lizzie, you kind of killed that presentation.
Thank
really
you.
Good. And how sweet was our wonderful patient?
She's awesome.
Like, so pleased with her results, and really had glowing, beautiful skin. So thank you for doing that for us. I don't think she's on, but thanks for doing that for us.
She was one of our first patients.
She was one of our first patients. So we've had this therapy for what, a year and a half?
About a year and a half, and that's, a good point to highlight is that it takes a bit of time for the results. So so the treatment is a series of 3 treatments, and those are done monthly. So that by the end of the 3rd one, even 6 months later, you're just sort of beginning to see your results. And another 6 months after that is when you'll really get to more like your full results. And generally, even from there, patients will continue to improve. So our patient who's 1.5 years out is even continuing to get benefit.
She has mentioned that she thought her scars might be improving. Is that possible?
That has not been documented in the studies. A lot of times scars look better because if you're still getting acne, then the scars are red, and so they really show. And if you're not getting any new acne, then it will all you won't be getting any new scars, so they won't be red. So the skin color overall will be a lot more even.
One of the other things that she mentioned that I think has changed with how we have treated patients over the course of the 1.5 years is that she mentioned that we didn't do any numbing before. Is that still the case?
No, not anymore. So I would say as it's been out for about 1.5 years now, like Dr. McNeil says, more research has been done about AviClear, and we've been able to talk to a lot of different physicians in the field of dermatology. And so we've started using topical numbing cream for the treatment, which is awesome because it just makes it so much more comfortable for patients. We still make sure that the skin is completely degreased. We have to do like a full cleansing kind of routine to really get it clean and set up for the laser. But we are able to do topical numbing now, which is a great addition.
So we've got some questions here. Let's start from the bottom.
Okay.
And just so you guys know, we're going to answer all your questions. These are all anonymous. No one watching can see what questions you're asking. So if you had something, personal to ask, and it's okay for, PGTV, then we'll answer it. But please feel free to ask all your questions.
So we can see your names, but nobody else can see your names if you ask the question.
Does Accutane work faster than AviClear? For a teen struggling with acne, would you recommend trying Accutane or AviClear first? Patient has already tried several other prescription topical routines. So that's a good question. I think probably.
That's a great question. I would say, as Dr. McNeil somewhat touched on with the laser, it definitely, there is some waiting time until you start to see the improvement. So in the way that it was studied, you see improvement about 6 months after the last treatment. So you have to think you start the treatments and then there's 3 treatments, which is 3 months. And most patients saw results at that 6-month mark, but you even continue to improve for another 6 months. So again, it takes a while to kind of see the results. And even once you start seeing them, even over the next 6 months, even after the next year, you still continue to see more improvements. Whereas Accutane, I would say most people start to see somewhat of an improvement around that 3 to 4 month mark, but it's very, very variable. So I would say as far as speed, that would be my answer. As far as what do we recommend trying first, that's going to be more of a conversation about what you feel comfortable with, and just about you in general. Unless you have anything to add.
I would say, I agree completely. Accutane is slightly more quick of onset, but I don't think of Accutane or AviClear as being
Quick.
the short-term fix. They're both the long-term fix. They're more like the long game in terms of getting your acne clear. Yeah. In the short term, there's lots of things. There's oral antibiotics, and there's diamond glows, and there's TheraClears. There's different procedures and things we can do in the office in general to kind of calm it down. But again, we don't want to keep people on antibiotics long term or have people always having to come in for procedures every 2 weeks to get their skin clear. So we can do other things in the short term, but AviClear or Accutane generally are kind of like the long term.
Yeah, more long term management.
One of the things that Cora, our patient, mentioned during her thing was she's like, no more doctor's visits, no more co-pays, no more prescriptions. So you get this treatment. So that's another thing to consider. Accutane is, you're taking a pill once or twice a day, every day for 30 days. You have to get,
requires a monthly follow-up.
There's a lot of work involved in taking the Accutane. Not to say it's not an excellent treatment, because it really is. And I've seen patients, I've seen miracles worked with Accutane. but the AviClear, it's 3 treatments, and you're in here, and there's no commitment after you leave here to do anything else.
No, not if it's not necessary or the patient's not wanting to come for some reason. We usually follow up just to make sure that you're improving, like, you know, we're expecting. And oftentimes, because it does take a little bit to see the improvement, we'll keep people on some sort of topical regimen. So we will manage that with you until you're at a place where you're happy with your skin.
Okay, perfect. I think we really answered that question. So next question is, does a patient have to stay out of the sun after the AviClear treatment?
Not especially. If they're still pink from the procedure, which sometimes they can be for a day or two, then you would want to have good sun protection. But any redness from the procedure is quite mild and goes away quickly. So just if you're pink and just for a day or two.
And then, hi. Can the laser be done on someone who is pregnant?
No.
Not currently pregnant.
And there's no real reason for that, except that we really don't do any laser procedures on pregnant patients. And we really don't do any elective procedures on pregnant patients, just out of an abundance of caution. It hasn't been studied in pregnant patients. Not that we really know of any harm.
It's shocking that pregnant women don't want to be studied while they're pregnant, right? Like, let's test and see how this goes. So yeah, that's part of the problem is, you know, there's not an abundance of patients that are pregnant that want to be tested to see if it's safe to use this laser. So we just err on the side of caution. Okay. Can you be a candidate for AviClear if you're currently applying a topical retinoid like tretinoin?
Totally. I, in my consults with patients, will often talk to them about starting a topical routine. And oftentimes that includes tretinoin or a retin-A of some sort. So yes, you can. And that's what most of my patients do, I would say.
Topical tretinoin helps acne and acne scars. So it's always a good thing to add.
You guys are killing it with these questions. This next participant feels bad because she came on late, but you didn't miss the pricing. We have not even talked about the pricing yet, did we? Did you bring it up in the show? You guys were talking so much.
Briefly, we talked about the deal. But...
Okay, so here's the thing. AviClear is $3,700 for the 3 treatments, and that's what the normal price is. You all, because you were smart enough to come to this event and you registered and you watched us, and you know we don't like to talk to ourselves. Well, sometimes we do. You get 10% off just for being here and coming to do. You have to do the consultation before the 15th, but we'll get you in for a consultation to see if you're a good candidate. And then, you know, reply yes that you want us to contact you, and then you'll get the 10% off. You'll also get this wonderful acne skincare regimen, and you might recognize the name on there. That's MD McNeil Dermatology. That's this lady. She's got this specially formulated medical grade skincare line, and she's chosen the products that are safe to use with AviClear, and you know will help you while you're in that process of getting through those 6 months. Okay. So you get that. And then you also get entered into win a Diamond Glow treatment if you do, you do the treatment. So Diamond Glow, what is Diamond Glow?
$225, I believe.
Not how much it costs, but what is it?
Oh, Diamond Glow is a facial that our nurses perform. It's a really great treatment. It feels just so nice. But it has a diamond tip, so it's kind of exfoliating, has a suction, so that can help with acne. And then it's also infusing a serum at the same time. So I'm assuming if you're on this video, you have acne, so you'd probably do the one that's for acne. So it's infusing an acne serum as well.
So just for watching, if you were wanting to participate and get this treatment, you'd be saving $500 for joining us tonight. So that's a great deal. Patient or participant, would I be able to stop taking spirolactone?
Yeah, so the goal, like Dr. McNeil was talking about, is that eventually you would have clearance of your acne and you wouldn't need to do anything. So when she said, it's a more long-term solution, that's what she means. I have various patients who want to stay on their spirolactone for that 6 to 12 months that you're waiting to see the improvement, so that you're continuing to do something for your acne during that waiting period. And I have some patients who they're doing the AviClear because they don't want to take any oral medications, and so it's also okay to stop it if that's what you want to do.
Great answers. Yeah, something, really came to light because I'm old and I have really dry skin and I don't typically have acne, but during the testimonial that the patient gave that we all saw, it's like her confidence came back. Like she felt almost immediately better about herself, and that's really valuable. So that was nice to hear, wasn't it?
Yeah, it's definitely something we see, people pulling their hair back more out of their face. And
Yeah.
Not wearing as much
very
makeup.
nice to see.
Well, and she also alluded to the fact that she's not doing any medications, any topicals or anything like that. Okay, so somebody's asking what the cost is. We reviewed that. It's $3,700, but for watching, you get this discount of 10% off, and I can go over that again. But that same person's also asking, is this covered by insurance? Unfortunately, no, it is not covered by insurance. We cannot bill it to insurance. We won't bill it to insurance. It's just not one of those things that we can do. So it is a cash pay visit. Okay. All right. Is it better to do before or after getting pregnant? Sorry for all the questions. We love the questions. If you weren't asking questions, then we'd be sitting here looking at the screen going.
I think it's better to do before, because then it's kind of, a lot of people, their skin clears up during pregnancy. Everybody's different, but a lot of times it clears up during pregnancy, and then afterwards is when it breaks out again. So it's good to do before while it's kind of kicking in, and then you'll have your benefit by time pregnancies.
It doesn't make the baby cuter.
All babies are cute.
Okay. Do you want to add before I interrupted?
No.
Okay. Does it work as well for cystic acne as it does for hormonal acne?
I think it works better for cystic acne than hormonal acne. If it's truly hormonal acne, I think that is the one case where the AviClear might not be as successful. A lot of people have kind of an overlap where there's multiple things going on, flares before their period or whatever. But some people really truly just have hormonal acne, and that is one case that I think hormonal treatments generally work better. But cystic acne, it works. So it can be mild to moderate, but it's certainly moderate to severe acne. All types of acne will improve with AviClear treatments.
Beautiful. Okay. 11 new questions about, we're so popular. Can this work for fungal acne? You guys, I didn't even know there was something called fungal acne. I have struggled with fungal acne on my back.
No, this wouldn't be a treatment for this. Is the way AviClear works is it shrinks the sebaceous glands in the skin, and those produce sebum that sort of clog the pore and cause the acne. But fungal acne generally is actually pretty straightforward to treat with anti-yeast or antifungal oral medications or topical medications. And AviClear would really kind of be overkill for that in general. If it's truly fungal acne, we should be able to clear it up.
Great.
Without a procedure.
Mm-hmm. So we need to get you in for an appointment. Mm-hmm. Is there increased skin sensitivity following the treatment?
Most of my patients, even by the time I go in kind of sections. So let's say I laser their forehead first, and then I go to laser their cheek and then their other cheek. By the time I get to the last cheek, even most patients, their forehead looks pretty normal. Most of my patients say that they feel completely normal. It is variable. So I always warn people, like as far as booking your schedule, personal life, to give yourself about 3 days in case you're swollen or red. But most people don't complain of pain post-procedure. It's really just the pain during the procedure. And then they don't complain of really any sensitivity or anything major.
Good, good, good. Okay, so I want to let you all know after tonight's event, you are going to receive a text message, okay, from us. Please reply with the word clear to be contacted for a consultation. Clear, get it? Because we want your skin to be clear. So just reply clear and we'll contact you tomorrow likely, okay? Can you do these treatments if you are nursing a baby?
Yes.
Mm-hmm.
Also, would this be beneficial for helping with perioral dermatitis? Our patients are so smart, aren't they? They just throw around these things, spirolactone, and spelled it right and everything. Okay, go ahead.
No, perioral dermatitis is more just an inflammation. It's a different cause, so I don't think it would improve with AviClear treatments. I haven't tried it, but I don't think it would.
Yeah. Love the Diamond Glow. Yes, it's a nice one. It's fun to get. Somebody said that. Any known risks if I'm currently breastfeeding?
No, that's fine.
Can you still get facials along with the treatment?
Yeah, you can.
And yes, not at the same time.
I wouldn't recommend it.
No.
But even like the next day, if you felt, I mean, do you agree with that? If you feel like the next day you don't have any residual redness or swelling, do you think it'd be okay?
Yeah.
We're almost finished up with questions. So if you guys have more questions, don't be shy. Keep asking. Once the questions are done, I'm going to go eat some tacos because it is Tuesday. Okay. What's the process of each appointment? How long does the laser take?
So this is also a little bit variable. I would say standardly you're probably here for about an hour. We'll often ask you to come in before your appointment time if you're interested in numbing, and let's say you're very sensitive to pain, we might give you 45 minutes to do that prior to the till the appointment starts. And then the process is basically we're going to wipe off the numbing. Oh yeah, we take photos so we can track progress. We'll take off the numbing, wash your face with some soap. We'll also wipe your face with acetone, which is lovely. We'll get it super clean. And then my part where I'm physically lasering, usually I could do it in about 30 minutes. Of course, like Cora was saying, if she's in pain and needed a break, we'll give you a little break. We'll, not like I leave the room, but we'll kind of stop for a second. So if you're someone who is needing a lot of breaks, it could take up to an hour. But usually I would say it takes me about 30 to 35 minutes of active lasering.
Mm-hmm. Excellent.
And what would you say on a scale of 1 to 10 pain is?
With the numbing cream, I would say most people say about a 4. Certain areas are going to be more sensitive. So as we get closer to the inside of the face, that's going to be a little bit more tender. The chin can be a little bit tender. And some pulses won't feel like anything at all. So it's kind of a funny thing. Some pulses will hurt, some pulses won't hurt. But in general, with the numbing cream, it's pretty comfortable.
These are really excellent questions. Next person wants to know, does it help with dark spots, acne scars?
So I think Dr. McNeil talked about the scars, but really it shouldn't be like your top choice if you're just dealing with dark spots. It should be more of a treatment for the acne itself than dealing with scarring or dark spots, because that laser is not necessarily going to target that issue.
Most dark spots will just fade, if you're not getting new acne. So it will help that.
Yeah. Do the appointments have to be 1 month apart, or can the timing be variable? It could be longer than a month, can it?
Yeah,
It can, yeah.
Just not sooner.
Yeah, I would say it was studied around a month apart, but obviously, weekends or if you're on vacation or something, it can be longer for sure. I have a few patients who've they come from out of town, so it's been longer than the month and it's been fine.
Yeah, some of the college kids have done it summer and then
spring
holiday
break or
and
whatever.
Spring break.
It's just most people want the series to be completed sooner so they can see the results sooner, right? And then people come from out of town because this isn't available everywhere. Like not every place has an AviClear. We're kind of a big deal, which I think you know already because you're watching us. But yeah.
There was a question if you could do it if you've had skin cancer before, and that question has come up previously. And it is okay if you've had skin cancer before. If there's any active skin cancer, we definitely would want to treat that before the AviClear treatment. But if you have a history of skin cancer or precancers and they're treated, then sure, it's no problem to do AviClear.
It's a really nice solution. I also noticed in the presentation, not the Cora part, but the part where they put up the pictures, the before at 6 months and 12 months. At 6 months they're looking very good, much improved. But then at the 12 months, so their active acne seems to be gone at 6 months. And then at the 12 months, it seems like, and the redness has gotten better, that, the scarring doesn't, at least it doesn't appear to be as bad. Their skin looks smoother. So that's really.
Yes, I agree. Those pictures were very consistent with what we see, that at about 6 months after the third treatment, maybe like an 80%, a pretty dramatic improvement. But then, a year after that last treatment, almost no acne. So that's where it gets this thing that it's as good as Accutane, or almost as good as Accutane, because Accutane's percentage is slightly higher, but still it's got that long-term, clearance and pretty dramatic without having to continually take a pill or continually do treatments.
Mm-hmm. I think someone also had a question about if their skin will look worse after, other than the redness, because most of the time the redness goes away. About 50% of my patients will say that they get an increase of acne kind of coming out after each session. In my experience, it's usually been around the 2-week mark after. Not everybody gets that. So I would say it's about half of patients get like a little bit of purging, is like a common term for that, where they're getting a little bit of an increased number in acne papules after each treatment.
Yeah, and we see that with Accutane too at the beginning of the treatment, a little bit of a purge. Sometimes it's usually not severe. Yeah, but it's that they all work in a similar way, shrinking the sebaceous glands, and then as those pores are kind of cleaning out, you can get a little bit of a flare.
Okay, so maybe this will help me eat chocolate or nuts without breaking out. Maybe, I don't know. So I'm getting ready to wrap up. I'm going to review the pricing again for those that might have missed it. And then if anyone has any more questions, we're going to just kind of wrap this up. But just to review, the special, which we haven't, I'm trying to think, did we do a special for Black Friday? I don't know that we've done a special for AviClear before. I feel like maybe this is the only time we've ever done it. So we don't discount this at all. We're doing this discount for you all this time because you've taken the time out to learn about it, and we wanted to offer you something for doing that. So you're going to get 10% off the $3,700, the series of 3 treatments. That's $3,700. You need to book a consultation before the 15th, but you don't need to have your first treatment before the 15th. And so you get 10% off. You get this lovely, McNeil Dermatology acne kit, which is a $126 value. So you get that. And then you'll also be entered in to win that Diamond Glow if you do purchase the series. If you're like, I know I'm a good candidate, I want to go ahead and book it, you can give us a call and we can book that appointment for you tomorrow. If you aren't sure and you want me to follow up with you, or you want someone else to follow up with you from the office, please remember to text back clear in your text messages, and that will let me know, hey, you're not bothering me if you give me a call. And that's kind of nice for me, because I only like to bother people sometimes. So so that's it, you guys. If there's no more questions, you guys really did a great job. I really appreciate you guys for joining us.
Good questions.
Good questions.
Thank you guys for joining.
I feel smarter. Okay. Bye. Have a great night.
Bye.
Go eat those tacos.